Like,
Good evening. I'm in conversation with Dr. Reetu Jain, a medical oncologist from Just Hospital and Research Center. As the Breast Cancer Awareness Month comes to an end, it still remains a leading cause of cancer for women worldwide and in India. What is particularly upsetting is the low survival rates in India for a type of cancer which is largely treatable if caught on time. Thank you for joining us, Doctor. We'll be talking about breast cancer awareness, the myths around it, and we'll also be taking in questions from the audience as they come in.
sure.
To begin with, there are so many myths associated with breast cancer which lead to confusion among women, and we'd like to burst them. The first one is that wearing wired bras can give me a breast cancer.
Well, that is not an absolute risk that wearing a wired bra would cause breast cancer, but we don't recommend it to be wearing it for 24 hours. For a few hours, for an occasion, it should be all right.
The next myth is that using anti-deodorants, antiperspirants, and deodorants are responsible for breast cancer at times.
This again is a risk using antiperspirants and antideodorants, but it is not that it's a risk factor, but not that it causes cancer.
Another very prevalent myth is that if somebody in my family has breast cancer, I will get it too, or there are high chances for me to get it.
Yeah, that's a very, very important question you have raised. Yes, see, if there is a family history, we have an entity called hereditary breast cancer, which accounts for 3 to 5% of all the breast cancer in women. Like if somebody, family member, like mother, has breast cancer, and if she's particularly carrying a gene called the BRCA1 or the BRCA2 gene, then if the children, the male children as well as the female, the sons and the daughters, if they are the carriers of the genes, then they would be prone for getting breast cancer. But it is not that if the mother has a breast cancer, the children would 100% get breast cancer. They would be at a risk. Second, if they are carrying the gene, if the mother is carrying the genes, then yes, children would get breast cancer. So they have to get tested for the genes.
And another one is that if I have breast implants, the chances of me getting cancer increase.
Uh, yes, we have an entity called a implant associated cancer, or there is also called a breast implant associated lymphoma. So yes, whenever we are offering patients a breast, means suppose a patient has undergone mastectomy or the breast has been removed and an implant has been done, they have a risk of developing cancer in that implant associated area. So we yes monitor them for that.
Moving on to the next myth is that only women get breast cancer. Is that true or not?
No, that again is a very important, relevant question. It's not that only women get breast cancer. Also, the men are also at risk of breast cancer, and especially the question which you asked about the hereditary breast cancer. If there is a mother, the family member has. So, if the family member has a breast cancer, mother has breast cancer, the chances of cancer in the son and the daughters are equal. So it's not that breast cancer is exclusively for happens in women. Even the males are prone for breast cancer.
I think that helped a lot of people. Moving on, it is that not having children or not breastfeeding puts me at the risk.
Yes. Yeah, these are very pertinent and important question. These are not myths. It's proven that women who have not breastfed the children, or what was the second question?
Not having children.
Yeah, yes, not having children, not having breastfed the children, and you are at a risk for breast cancer. So we promote actively breastfeeding and also having, bearing children. So they reduce the risk of getting cancer, especially not only the breast cancer, even the ovarian cancers.
Thank you for clearing those myths. For those just joining in, we are joined by Dr. Reetu Jain from Just Hospital and Research Center. She's a medical oncologist, and we're talking about breast cancer awareness and busting myths around it. So, doctor, despite the pink ribbon campaigns and the awareness just tried to be, around breast cancer, still the awareness is relatively low, and women tend to go to the hospital and get checked at a very later stage till when it becomes complicated. So, what are some of the signs of breast cancer that we should look for?
Yeah, that's a very, very important question. Yet, yes, in the metropolitan city also we face, because the first reason is that the women are very shy. They feel if something comes out, then the whole family gets disturbed. So somehow women place their health somewhere low down the card. So that is one thing. And the second thing, the signs and symptoms you ask, most of the time, a breast cancer lump would be painless. Majority of the time, I see a lot of young women coming to us that we didn't come because there was no pain. So remember that if there is a pain, be reassured that there is no breast cancer. So regarding the other signs and symptoms, if you feel a lump or a mass palpable, if you can feel your breast, or your nipple is inverted, or if you feel one breast is bigger than the other breast, or there are some skin changes on your breast, or in your armpit if you find some lumps, or something abnormal if you feel in your armpits, or there is some discharge from the nipple which is not white but some blood discharge from the nipple, or there is some dimpling of your skin, or your nipple is retracted. So these could be the features of breast cancer. But remember, if there is any pain, be reassured that this is not a sign of breast cancer.
Okay. Talking about symptoms, we don't really know about self exams and at what age should we start doing it. So, if you could tell our audience something about that, what age should we start and what should we look for and how to do a self exam?
Yeah, this is again a very, very, very relevant question. She asked me two questions. So, when should we start doing the breast examination, self breast examination, and when and how? So, self breast examination ideally means we recommend from the age of 18 plus, and we do it by two methods, by seeing method and by palpating method. So the seeing method, or by observing. So we would recommend that you in front of the mirrors, in front of the mirror, you observe both your breast, and especially the ideal time to do the breast self examination is just after you have finished with your periods, because just before your periods your breast might be swollen, and also that would not be an ideal time. So after your periods are over, that would be the ideal time. In the seeing method, what we do, you remove your bra, stand in front of the mirror, observe like whatever symptoms, whatever signs I have told you, any difference in the size of your breast, your nipple size you observe, skin you observe, any asymmetry of your breast is there, anything abnormal, if you see. So that's the seeing method, right? Then we come to the palpating method, or you feel it. Now the feeling method, you normally you palpate with your, not the fingertips but the this from this, and you go horizontally and laterally, and then you go circular wise. So each breast you palpate in front of the mirror, and then you can keep both your hands and then palpate from each. And if you do it regularly, like we have seen that women who have been regularly examining their breast, they can pick up the the tumor size or the cancer even 1 or 1.52 centimeters. Many times they come to us, even we can't palpate, but because they have been doing it regularly, they are very much aware, or they know their breast very well. So even something abnormal they find, they'll pick it up. So that is the reason we always recommend that do it regularly. So these are the two methods where we can pick up. As against women who do it occasionally, they will come to us when it's this big size, or where the women who have been regularly doing it, even a small peanut size, they can pick the a tumor or a cancer. So that is the way we will recommend.
So, as you said, above 18, after the age of 18, we should start doing self-breast exams and everything. Another place where we have a conflicting advice from many people is about mammograms. At what age should we do? Should we do or not, and how?
See, if there's a family history of breast cancer, then we recommend that above the age of, after 35 to 40 years, once in 2 years a mammogram should be done. And if there is no family history, after age of 40-45, mammogram should be done. But nowadays there are a lot of studies from the West which have shown that mammogram does not pick up breast cancers, and even in the West, many centers are not recommending mammogram. The best way is to do a regular breast self examination and a yearly breast self examination by a physician or a, your oncologist. Nobody goes to an oncologist directly, but yes, your local physician, you should be doing it. But there's families, yes, we do recommend.
So there is, we think, not just one type of breast cancer, but different types of breast cancer and different treatments for them. So as we know, not everyone having a breast cancer needs to go through radiation and chemotherapy. So can you, for our audience, explain who needs chemo and what is the treatment that they should be getting given different types of breast cancer?
Yeah, again, this she has actually asked my. This question is very dear to me because whenever we go out to give awareness talks, like we always tell patients to come in early, because if we detect it in early stages, let's say in stage 1, then you just need a surgery. You don't need chemotherapy. You don't need radiation. As your stage increases, then there comes the chemotherapy, radiotherapy. Your treatment gets prolonged. So in stage 1, nowadays even we are doing breast conservation surgery. Like suppose if your tumor size is very small, like you have detected at a stage, I mean the tumor size is 1.52 centimeters. We just remove that tumor, that hole, that we don't remove the breast, only that lump is removed. So that, we are conserving your organ. Then you don't need the chemo, you don't need radiation. But as we go on from stage 2B onwards, and it has spread in the armpits also, then definitely you need to undergo chemotherapy, then again radiation, and then suppose if we do certain tests, and if you test positive for those hormone tests, then we may put you on those hormone tablets for 10 years. So my message to everybody is that if we detect it early, then surgery is enough. You don't need to undergo surgery, chemotherapy, radiation. But as you move on from stage 1, you go to stage 2, stage 3, you need to undergo surgery, you need to undergo chemotherapy, you need to undergo radiation. And now we have targeted therapies also, which we give it for a year. So as you go higher up in your stage, even the treatment gets prolonged.
So for women who have had surgeries for breast cancer, often it's very difficult for them to cope up with the post-operation mechanism. And so what counseling will you want to give to the women who have lost their breasts, or and what are the options for them available now?
See, first of all, I would like to say that nowadays we as oncologists, we believe in, as because there's so much advancement in technology, it is not necessary that you have to remove the breast. We can conserve the breast. But fortunately in India, I would say 95 to 96% of the patients, in fact, it's not the patient, the family members decide, that remove it, so then we don't want any stress and all. So majority of the time the breast does not need to be removed. We can conserve the breast, but because of so many fear factor, they opt for removing the breast, which is, according to us, it's not required. So that is one thing, that counseling, that we can conserve your breast, we can conserve your organ, so please do not go for mastectomy. We would encourage the women to take informed decision. What is your risk? Suppose if we conserve the breast, yes, if we do a conservative surgery, there may be a chance of 2 or 3% of recurrence in the same site. Again, we can do a surgery. So that is one thing. But if they have decided that she will undergo a mastectomy, yes, then we do a lot of counseling. Then they have to do exercises, because there's a lot of armpit edema, that this arm gets swollen. So all those exercises, physiotherapy also they have to undergo. And then if somebody is opting for prosthesis, the surgical side, they would offer them breast prosthesis. And then we have bras also with padding, and silicone implants also, though silicone implants are not so popular with our patients. So these are the options for the patients who have undergone mastectomy.
Talking about families and how they deal with the situation, what advice do you have for the families and relatives? Because the cancer doesn't just drain the patient, but also the families along with them.
So my advice to the family would be that be supportive to the lady of the house, and don't get fearful. Cancer is just in the mind. The word is scary, but if you come early in stage 1, stage 2, it's curable. And it is not like other diseases like diabetes, blood pressure, where you have to be on medications lifelong. Plus, in the other diseases, it affects the other organs. But breast cancer, stage 1, stage 2, you have 100% curability, and you don't need lifelong drugs, nor does it affect the other organs also. So the fear factor needs to go. Second, it is not a taboo to have, because people hide. They don't even want their immediate family members to know. Support the lady of the house, when, especially if suppose if she's undergoing chemotherapy, she needs a lot of emotional, moral, mental, financial support. So support is very important. And if they feel that they need to see a counselor also, so there is no harm in seeing a counselor.
And lastly, doctor, there are so many breast cancer survivors today who say that they don't let the disease affect who they are, or define them. So what message do you have for those who are still struggling with breast cancer?
Struggling in what sense?
Who still are trying to cope up with it, or who are going through radiation or chemotherapy, and how they should take it.
Yeah. See, as I said in my earlier answer, that don't fear it. Talk to people, talk to your doctor, talk to your counselors. There are a lot of support groups also, so you can talk to them. Maintain good hydration, eat well, be physically active, do yoga, pranayam. Now it has been scientifically proven that patients who are undergoing chemotherapy, who are physically active, who do pranayam, yoga, they have less side effects of chemotherapy, radiation. So eat well, sleep on time, talk to patients who are undergoing treatment, so you get a lot of myths also get cleared. And if any doubt is there, you can talk to your whole entire healthcare team, your treating oncologist, your radiation oncologist, your counselor, the nursing staff. So keep on talking, so that you are not alone in this battle. And remember, it's just, even the chemotherapy will come to an end. It is not a lifelong treatment like other diseases. It may be for 6 cycles, 7 cycles, but the fear factor has to go, and they have to, it's a mental barrier which they need to overcome.
So I think that's about it. Thank you so much for joining us, doctor. And please do like and share our page, Quint Fit, and stay tuned for more updates. Thank you.